right, we'll continue our discussion of the central nervous system, looking first at the brain and then following up with the spinal cord. So we talked last time about the cerebral cortex. Now we're going to move our way down the brain to the Diencephalon. And the Diencephalon is the central region within the brain, kind of like the nut or of a walnut, where the shell is the cerebral cortex, or you can think of it as the pit in a peach, this central portion here. And if we look at the parts that make up the diencephalon, it's made up of the thalamus, the hypothalamus, and the epithalamus. We're not going to talk about the epithalamus, but it does exist, so just be aware of that. But the two major regions that we're going to focus on are the thalamus and the hypothalamus. So here you can see the thalamus is made up of these two major lobes. And the function of the thalamus is to act kind of like the brain secretary. Information is coming and going to and from the cortex, and the thalamus relays that information, or it inhibits it. Some information that comes down to the thalamus is not necessary information for a motor response, so the thalamus will inhibit that information. The same goes for sensory information. Information coming in is not necessarily important for the brain to recognize, so the thalamus will inhibit it. So it's really a relay center for information coming into the brain, and then the thalamus projects that information to the correct part of the higher brain centers. So it's important for sensation, motor response, arousal, learning, memory, all those higher order thinking skills all kind of begin with the thalamus deciding what's important, what's not important, and where that information should be sent. The hypothalamus is part of the diencephalon that lies below the thalamus. So if we look here in this diagram, the hypothalamus is this region below the thalamus. Right here is another diagram of the hypothalamus, just this region below. And it is very important for homeostasis. It's a major controller of the autonomic nervous system, so your blood pressure, heart rate, digestive tract motility, size of your pupils, all controlled by the autonomic nervous system. Control of temperature is another important function of the hypothalamus. Gland secretion, which is part of the endocrine system, is controlled by the hypothalamus. Recall that the pituitary gland extends from a stalk from the hypothalamus. So the hypothalamus is a major controller of the pituitary gland, and it actually produces hormones that are stored in the posterior portion of the pituitary gland. So many of the responses that we see to our emotional responses and feelings, which is part of the limbic system, we'll talk about that in a little bit, but those physical responses, like if somebody walks in the room that maybe you've had a difficult history with, and you get a feeling of fear or anger as they walk in the room, the response, the physical responses of anger, the increased heart rate, the increased respiratory rate, those are mediated by the hypothalamus. When we respond to changes in body temperature, remember when you talked about negative feedback controls, the hypothalamus was the integration center or the control center. It determined whether the effector organs of sweat glands or muscles should initiate sweating or shivering. So very, very important in homeostasis and negative feedback control. When we feel hungry and the drive to eat, that is a response to hunger centers that begin in the hypothalamus. When we feel the need to drink water when we're thirsty, that is initiated in the hypothalamus. And our ability to become tired at night and to feel rested in the morning, again, is a function of the hypothalamus. So even though it's a very small part of the brain, many, many important functions. And it's important that you see what I've highlighted in red here. The autonomic nervous system control and endocrine system control are two very important functions of the hypothalamus. Now the next couple of structures we're going to talk about, the basal nuclei and the limbic system, are actually several different structures kind of working together to form these special areas of the brain. So the basal nuclei are little clusters of gray matter throughout the internal portions of the brain that have special functions. And a big one is muscle control, muscle movements. And cognition, which is the ability to think, and our emotions are somewhat dictated by the basal nuclei, and our intensity of slower stereotyped movements. What that means is simply like walking. That's a stereotyped movement. We usually swing our arms and move our legs in a stereotyped manner when we walk, and how we do that is controlled by the basal nuclei. And again, sometimes we have information that is not appropriate to the circumstance that is initiated within the motor cortex, and the basal nuclei filters that information out. So people with Parkinson's disease have damage to the basal nuclei, and it's specifically this part of the basal nuclei, which is the substantia nigra. Those neurons break down and do not release dopamine. And dopamine is necessary to filter out those unnecessary movements and control our motor response. And without dopamine release from the neurons in the substantia nigra, we have shaking movements and excess motor control that is not inhibited by the dopamine. The limbic system is called our emotional brain, and this is, again, a number of structures, all shown in green here. Again, it's not important that you know the individual pieces, but just that you understand that these specific parts of the brain all work together to associate some stimuli with memories. For example, if you walk into a house or into a room and you say, oh, this smells like my grandmother's house, and you get a good feeling of maybe Christmas at your grandmother's when you were a child, that's the limbic system. That's the emotions associated with some of that stimuli. Sometimes when people are overly stressed, they develop illnesses that are imagined illnesses. So they dream up, like, for example, if they think that, they're under stress, they might feel like they have chest pain. And then when they go to have an EKG done, there's no indications of chest pain. Well, where is that chest pain coming from? That chest pain can be a psychosomatic illness, which means that people feel they're under stress and might be at risk for a heart attack. They're going to start feeling the symptoms of a heart attack, even though there are no cause for those symptoms. Sometimes we have impulses driven by our emotions that don't follow logic. For example, cravings. When someone craves pizza and they have just an urge because they saw pizza at work earlier in the day, they have an urge to eat pizza. Or extreme thirst for drinking down a half a liter bottle of Mountain Dew, for example. That's not necessarily satisfying thirst. It's just a drive, emotional drive to drink something sugary and large volume. When people have extramarital affairs or they have intercourse with somebody whom they normally wouldn't do that with, now this is not taking into account the influence of alcohol or drugs on our actions and our inhibitions, but this is just people that feel strong drives and urges that are not necessarily appropriate. That's the limbic system playing a role, and it's a survival part of our brain. We survive by having intercourse with people. It's a survival mechanism for the species to promote rebirth and a new generation. And hunger and thirst is a survival response to make sure that we're taking in calories when they're available. But here in the United States, we don't usually have a shortage of calories, but we do tend to overeat and drink too much because of our genetic drive through the limbic system to take in calories and beverages when they're available. Another part of the brain, as we work our way down, is the cerebellum. Remember, that's this little brain that comes off the back of the brainstem, and it works to initiate voluntary muscle contraction. So it is part of the pathway descending from the cerebral cortex to control muscle contraction. It also gives information from proprioceptors. Remember, that's our body position, those receptors that tell us about body position. We find proprioceptors in our joints, ligaments, tendons, muscles. So it gives us a sense of equilibrium and balance. So when we look at equilibrium and balance, the cerebellum plays a large role in that. And also smooth flowing movements are also coordinated by the cerebellum. So when you look at someone who is, say, a professional ice skater, they might be someone who does figure skating, they may have a well-developed cerebellum with refined connections for controlling those smooth flowing movements. And it does play a smaller role in thinking, language, and emotions. But primarily you should associate the cerebellum to smooth flowing movements and balance in terms of that body position. Then we get to the brainstem, and the most important structure of the brainstem is the medulla. You can see there's a number of neurons coming off of the medulla, but important functions of the medulla are to control our respiratory rate. So our rate and depth of breathing, with some help from the pons, is the primary function of the medulla. We also have centers for vomiting, hiccuping, swallowing, coughing, and sneezing. A lot of these are protective mechanisms to prevent us from ingesting things that we shouldn't, or inhaling things into our airways that shouldn't be there, that might promote infection. So the medulla is responsible for those kind of reflex actions. We also see some overlap with the autonomic nervous system response. Some of that information that we see coming from the hypothalamus, or coming to the hypothalamus, comes from the medulla. So we'll talk about that when we get to, the reflex where the bladder contracts, or respirations in association with emotions and things like that. We'll get into those details with the autonomic nervous system and the urinary system. And then the cardiovascular center, so how fast our heart beats and how strong it beats is controlled by the medulla, as well as the size of our blood vessels. So if our blood pressure is low, the response from the body would be to constrict the blood vessels to raise blood pressure. So the diameter of our blood vessels is controlled and regulated by the medulla. So it's safe to say, based on all this important functions of the medulla, that if we have damage to the medulla where it's not functioning, that would result in death, because you would have no ability for autonomic reflexes and cardiovascular or respiratory control. Another unique part of the brain is the reticular activating system, which is a set of neurons that we see that runs along the brainstem here. It's shown in pink, that is bringing information to the cerebral cortex for awareness. So when this is activated via stimuli coming from the spinal cord from the outside, as well as from the eye, that is projected to the different parts of the cerebral cortex and allowing us to respond. So when we talk about the reticular activating system, it's something that just makes you alert and aware. Sometimes information coming in is not important, so repetitive, familiar, or weak stimuli is filtered out by these neurons and is not projected to the cerebral cortex for awareness. And we see that, for example, in mothers. From myself, for example, I have a lot of children in our home, and it gets to be pretty noisy. But because that is repetitive and familiar, I don't notice noisy children in the home. If something unusual would happen, a child cries in a specific way, then that's unfamiliar, not repetitive, and I find that I'll respond to that. But other people will say, gosh, doesn't this noise bother you? And I think, gosh, you know what? I don't even notice it. So that's part of the reticular activating system that causes us to kind of drown out, or filter out, I should say, repetitive, familiar noises. And that can be a problem sometimes if you're looking at, say, the sounds of a call light, or a beeping sound associated with an alarm that goes off quite frequently. We will tend to filter that out, and that's not good for the patient, who might need us to interact with them to respond to that alarm. We also, with the help of alcohol, drugs, and just normal sleep centers in our brain, that will shut down the reticular activating system. So some people that have a lot of stress, or just don't want to be alert and conscious of their environment because of maybe a difficult living situation or whatever, they self-medicate using alcohol or street drugs, because that shuts down the reticular activating system and prevents it from being aware of the environment, and just kind of allows them to tune out. Damage to the brain can cause a coma, and that's where some people will never regain consciousness because of damage to the reticular activating center. It's just impossible to become alert and come out of the coma. When we give a patient anesthesia, that drug is shutting down the reticular activating system. And this is particularly important to consider when you think of the use of, electronic devices like our telephones, computers, tablets. All of that information comes in and stimulates the RAS, the reticular activating system. So when you're looking at a flashing computer screen or a flashing cell phone or an iPad and you're, say, in bed or getting ready for bed, that is stimulating your brain and preventing it from shutting down, allowing you to get drowsy and fall asleep. And it's a real problem among school-age children that they're playing video games or watching television or interacting with the computer on Facebook right before bed, that it stimulates the RAS and they're unable to get sleepy and fall asleep until sometimes 1, 2 in the morning. And we have seen as a society that kids are really sleep deprived because of being on their devices too late in the evening. They actually recommend people shut their devices down at least 2 hours prior to when they're going to go to bed to allow that reticular activating system to slow down and not be so hyper aware. So we'll pick up next time in the next set of notes with the ventricles of the brain.